As nurses, we both know that your shift starts before you even step foot on the unit. What you wear can really set the tone for your entire day, and that is why I love FIGS. Back in nursing school, I remember those boxy, scratchy scrubs that felt like wearing a paper bag. FIGS has changed everything. They make scrubs for people who actually work in healthcare. The first thing I noticed when I tried them on was how flattering they are. You know that feeling when something just fits right? FIGS somehow nails it. And they're not just about looks. FIGS scrubs are antimicrobial to help keep you protected, durable enough for wash after wash, and seriously, some of the most comfortable scrubs I've ever worn. With the holidays right around the corner, it's the perfect time to treat yourself or your favorite nurse to something new for the new year. FIGS just dropped a bunch of limited edition colors and styles, and I already have a few on my wish list. From scrubs to accessories to footwear, FIGS has a little something for every awesome human. If you want to check them out, FIGS is offering 15% off your first purchase at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX.
Rinse takes your laundry and hand delivers it to your door, expertly cleaned and folded. So you could take the time once spent folding and sorting and waiting to finally pursue a whole new version of you. Like Tea Time You. Or this Tea Time You. Or even this Tea Time You.
Said you hear about Dave?
Or even Tea Time You.
So update on Dave.
It's up to you. We'll take the laundry. Rinse. It's time to be great.
Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So in this shorty episode, we're going to be clearing up a concept that can be a little bit confusing, especially if you're brand new, and that is the difference between infiltration and extravasation. So first, let's talk about infiltration. So infiltration happens when IV fluid leaks out of the vessel and into the surrounding tissues. Now, the substance that is leaking is what basically makes the difference between infiltration and extravasation. So in infiltration, the substance that is leaking is a non-vesicant, something like normal saline or D5W or something like that. So when your patient has an infiltration, you could see things like the site is swollen, it's cool to the touch because you're feeling the temperature of the fluid, not necessarily the temperature of the body, and it can be pale. The patient might say it feels tight, it feels uncomfortable, it's painful. So if you have an infiltration, what do? You're going to stop that infusion, remove that IV, elevate the limb and apply, usually like a warm compress will help, and maybe a cold compress. It kind of just depends if your facility has a specific policy. Usually the discomfort is pretty minimal and it resolves pretty quickly. Now, extravasation is basically an infiltration, but it's of a vesicant medication, and a vesicant is something that can cause tissue damage. And when this medication that can cause tissue damage leaks out of the vein into the surrounding tissue, we call that an extravasation. So examples of medications that can cause extravasation include certain antibiotics like vancomycin, chemotherapy drugs, and vasopressors such as norepinephrine. So when your patient has an extravasation, you'll probably see similar signs to infiltration, that swelling, that pain, maybe some redness with that, but it can also be much, much worse. You can see things like blistering, necrosis, like very significant tissue injury. And I would say the pain is going to be much higher with an extravasation than with an infiltration. So another key difference is what are we doing about it? So we're stopping the infusion, but we're probably, in most cases, the policy at your facility states to leave the IV catheter in place because in some cases you may be able to administer an antidote through that same IV catheter. You also want to make sure that you're following your pharmacy recommendations for treating that extravasation. Like, for example, with a vasoconstrictor, like let's say norepinephrine, leaked into the surrounding tissue and is causing vasoconstriction, which is going to be not good at all for that tissue, then it could be that you're applying something like nitroglycerin paste to cause vasodilation at that site instead. So you're going to follow your pharmacy recommendations for treating that extravasation and, of course, letting the physician know as well. So ideally, we catch an infiltration or an extravasation before it causes significant problems for our patients. And that is why it's really important to always be very conscious and careful with your IV site assessments, not ignoring those assessments, especially when there's potential vesicant medications infusing through them. I heard a story about a woman who had, I believe it was vancomycin. It might have been a different drug, but I think it was vancomycin infusing through an IV in the hand. It became an extravasation, and she ultimately, I don't know if she lost her hand, but the damage was incredibly, incredibly intense and very debilitating for her. So, and it was simply because no one had checked that IV for an entire shift. So it had just continued. Even though she was complaining of pain at the IV site, nothing was done about it. So that's another great point. If your patient's complaining of pain at the IV site, that's not normal. Yes, IVs can be a little bit uncomfortable, but they shouldn't be painful. And the pain definitely should not increase over time. So if your patient says, my IV hurts, you need to stop what you're doing, take a look, and see if they've had an infiltration or an extravasation. So I hope that helps clear up this issue, infiltration versus extravasation. I will see you soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.